So open all the way, open your mouth large, and then close off.
Ooh.
Big breath in, and blow it out.
Oh.
Wow.
Wow.
And when you're ready, you can open your mouth really big,
Okay.
and then you close it and seal it off.
Oh.
You're done. That was perfect.
Ooh.
You felt it go all the way back, right?
Yeah.
So we have Tamika and her husband Hito here today, and we're gonna do some cranial facial release. Tamika reached out to me because she gets migraines, right? How long have you gotten migraines? Most of your adult life?
Yes.
Do you get them as a teenager too?
Yeah.
How old were you when you first remember getting them?
About 15.
15 years old?
Yeah.
Okay. How often do you get them? Once a week, once a month,
Oh.
once a year?
Every day. Every
Really?
day, every other day. Yeah.
You get a headache every day.
Every day.
Do you wake up with a headache?
Sometimes I wake up with it. Sometimes I don't, and I eventually get it. Maybe middle of the day. Yeah.
Okay. And does it hit one side of the head, like the right eye, the left
it
eye?
depends. It
Describe
could
it.
be right, the left. Sometimes it's the middle, or the entire head.
Does it mess up with your vision, or are you
Yes.
sensitive to light?
Very sensitive to light, to music, to noise, everything.
What's the most you'll ever go without a headache? 2-3 days, a week, or not even?
Maybe like 2 days sometimes. Yeah.
Yeah.
If I'm like away on a vacation or something, relax.
Now, what do you do for a living?
I drive a school bus.
You drive a school bus, okay. And so, did you ever have to drive a school bus with a bad headache?
All day.
Yeah. So that's a tough job, by the way. You know, a lot of people think anything with kids are cute, and they are. But the responsibility of driving a New York City school bus is probably really intense.
Yeah.
First of all, the traffic and just the craziness of the other drivers, right?
Yes.
The craziness of the people, the school board, the parents,
Traffic. Everything.
and then have a migraine on top of it. Okay, so we're going to do our best to help her today. And then tell us a little bit about you. Do you have any breathing issues? Did you ever get hit in the nose? Anything that we should know about?
Just when I was young,
What happened?
playing tag with a friend of mine,
Yeah.
I bumped into his head, and from there I think I broke my nose, or maybe it went out of place or something.
Okay. And do you have trouble, like, try right now, both of you, which side is easier, which side is the problem?
This
So
is the problem here.
you know right away.
Yeah.
Yeah, mine's is the right side too.
So wait, your left side's your
My
problem.
left side
And
is
your
mine,
for
yeah.
it's more your right
So
side.
it's easier.
Yeah. All right. So we're gonna work on both of you today. Plus, you have some. You told me you have some lower back.
Lower back problems.
Yeah. And do you have spots too?
My neck.
Neck.
Yes.
Okay. Like, if you went, don't bump into the wall, so you might have to step out a little bit. But if you started to go towards touching your toes, stop when you feel tightness or pain. Okay. So here, walk forward just a little bit, and now do it. Okay. Any pain going that direction?
Right there.
And point to it.
Right, the lower.
Okay, so come get up carefully and turn around so we can see what you're pointing to. So you're pointing here. You know, I have to stop for a second and talk about these T-shirts, okay? Is there any story behind the T-shirt? Tell me what this is. This is great. I like his shirt. It's crazy cool. And, well, Metallica is always good.
Mine is regular. This one is my uncle, who passed away recently, and I kept a lot of his wardrobe. And every tour he went to, he bought a shirt, and he collected a shirt. This is from 1992.
And this is here. So this is your uncle's, like, your uncle went to a lot of these events?
Yes.
And just love this stuff, right? So it's so nice that you were able to
Just pass it down.
pass it down to your
Yeah.
husband.
Yeah.
It's really nice. And
Well,
they're-
they really mine by them.
but it's sentimental for you, right?
Yeah.
Yeah, that's really great. All right, so let's do this. I'm gonna have you, Hito, just relax for a little bit, okay? You can watch. You're gonna sit here. We'll see you in a minute.
Okay.
And you're gonna lie face down. We're gonna give you a full body adjustment, but we're gonna spend most of the time on your cranial facial release today. Okay, so put your nose in here, and you'll be on your belly. So just lie flat on your belly. Have you ever been adjusted before?
No.
So you're gonna put your arms up here on the table like this, And I'm just going to start feeling your neck and shoulders. So you're so tight up here. Oh, turn your head this way and sweep your hair off your face so we can see you. And just turn towards this direction, towards where your husband's sitting. And can you feel these muscles in here? Are they really achy?
No, not that much. They hurt, but
How about if I put my elbow in there?
oh yeah, that hurts.
Okay. Like there? So on a scale of 1 to 10, 1 you don't notice it at all, and 10 that really hurts. What number would you say this
10.
was? That's a 10? Okay. Still a 10? Okay, sorry. And what I'm feeling is a real rigid muscle here. And this muscle's been tight for many years, I think. Like right in there. Do you feel this one?
Yes.
That might even be worse, right?
Oh yeah.
All right.
You know, I even feel it lower when you're doing it there.
Really? So we're going to do a big adjustment here, okay? So I want you to take a big breath in and blow it out. So you can't get a good breath. Their nose needs work. Big breath in and blow it out. Big breath in and blow it out.
Oh.
What was that like?
Ooh.
Pretty good.
Relief. Yeah. Oh.
Good. Let's do another one. Right up in here. Big breath in and blow it out.
Oh.
Head back to center. A little more. All right. Lie on your back next. And you're going to turn and lie back down again. So I'm going to just pull on your ankle first. So watch me down here with the camera. Got it. Got it. All right. Is that okay? You feel the ankle pop?
Yes.
Now I'm going to reach under you and get into the back again, okay?
Oh.
That was another crack, right?
Yeah.
Here, scoot down towards me. And now lie on your side facing me this way. You're going to bend the top knee. And then this one tucks. Hop closer to me. So you're going to be a little closer to the edge. Let your shoulders come back now. And I'm going to try to get this hip to release a little too. Got it.
Oh.
How was that?
Whoa.
Good. And then turn this way. You're going to keep going to this side now. We're just going to get everything on you, okay? Got it. That was a smaller one, but it worked.
Yeah.
Good. So lie on your back now and put your legs out straight. And we're going to do the Y strap next, okay?
Ooh.
You're doing all the tough stuff today. Pick your head up and pull your hair through to make sure it's not catching. And drop your head again. Drop down. Big breath in and blow it out. One more. Big breath in and blow it out.
Oh.
What do you think of that?
Whoa. I feel like
I was pulled from here up. Ooh.
You were.
Oh, that was good.
Now watch, this even gets better. You ready? That one's fine. We'll leave that one. All right, my dear. Now we get going more. So, a couple of pieces. We're going to put this behind your neck. Open your eyes, okay? That goes behind your neck to just let your neck relax, okay?
Okay.
Does that feel good?
Yeah.
Good. And you said the, which one was the tougher one? Was the right? The left.
The left.
So we're going to start on the right. And this is floppy. Okay, hold on to floppy. Floppy is part of it. This is for your other hand. This is tissues, because sometimes your eyes tear, or you feel like you got to blow your nose or something, okay? And I'll be right there. Let me just set this up. So we'll just stay on you. You must be a little nervous, right?
Yes.
Yeah.
I'm
What
sensitive
are
for
you
my
most
nose.
nervous about? That it's going to hurt, or?
My breathing. So I could barely breathe through my nose. So knowing that that's gonna go up my nose, and then my mouth, it might come out through my mouth. I'm not sure what's gonna happen, but I just feel like.
Yeah, I was very nervous to get this done too. So again, which one is the problem side? Is the left.
Yes.
So we're going to start on the right, okay?
Yeah.
You ready? So I'm going to push this back, get it set, then you'll open your mouth, close, and we'll go. But I'll talk you through everything, okay? It's going right in, no problem. Breathe a little bit because we haven't done anything yet.
Ooh.
1 second. Try to relax. You can do it.
Ooh.
Here, move the camera just a little so my head can fit.
Oh, that hurts.
That's the spot, though. That's what we. I think I got it. Okay, when you're ready, open your mouth and seal your mouth closed. Hold your breath. So open all the way. Open your mouth large, and then close off.
Ooh. Ooh. I felt my ears pop. Oh, everything just cracked. Everything. My ears, I feel like my, ooh.
What did the cracking sound like?
Oh, just like fireworks. Like.
Now, believe it or not, I only got 90% of that back there. So,
Oh.
you know, if we do this again, we would definitely want to, like, sometimes we'll go back and do that right side again. It's up to you, but we can go on to the left. What do you think? I mean, I got a lot of it. You did feel the cracking.
Oh, I felt the cracking, like all of this from the back here, all the way up like this.
All right, so let's leave the right side because I think I got enough of it for this first time. Plus, that's not even your problem side. So what I want to say is that ultimately you want it to go 100% throughout the back and actually even expand into the throat. Just at the moment that I was about to get it to go that last 10%, she reached up to grab my hand or something, like she fought me. And I should have just like ignored that and just blasted it through. But I am sensitive to her that she was uncomfortable. And then it ballooned back out. So the last 10% rebounded out. And that's not a fail because she got so much cracking. I mean, you got like crazy cracking anyway, right? But I wouldn't say it's 100% full release. We got about 90% of it. You know, and I tell people this is a process anyway. Most people should really average 4 of these treatments, and today is just 1 treatment. But I think we should go into the left side because this is pretty intense for you. And it was intense just getting the balloon back there, don't you think?
Yeah.
Okay, even that you were not doing that well with. So let's...
It feels good though. I can breathe.
Should we do the other side? That's the one that's going to make a big
Poor
difference.
guy.
Yeah, you squeezed him to death. Poor Floppy the bear. I mean, the
let's
dog.
go for it.
All right,
Yeah.
good. You should. Everybody watching is going to want you to go for it too because they want you to have results. You ready? Try to relax your face. That one went in much better. When you're ready, you'll just hold your breath. Open and then hold your breath. But you gotta open your mouth first so I see open. And then close. Got it. So that was a full one.
Oh.
That was a full one.
Oh. I felt that in my throat.
Yeah, so that's where you needed to hit.
Ooh.
You did 100% on that one. Let's have you sit up, okay? And I'll get you more tissues. And stay with her and come around front and film her from the front so we can see her really well.
Oh, sorry. Oh, wow. Whoa.
What do you think? What did you hear? How is it different from the right to the left? So the
I-
right one was the first one.
Yeah, I felt all the cracking again. I heard everything. I felt like my ears was like opening up more, and my throat.
Do you have a headache right now?
No.
Did you have a headache when you came in today?
I did back here a little bit. Yeah, it was like, coming.
And does it feel like it's still coming, or do you feel like it's a little different?
I'm just trying to I don't know. I feel like I could breathe. Wow.
What else do you have to say? It's crazy, right? It's
Yeah,
emotional.
it feels good. Yeah,
Like
it's
you almost
emotional. I
can't
feel
tell.
like I was like so tight and close for so long that it just like opened up my ears. Like I could hear better. I don't know. And then all this just cracked back here. Like I don't know what it was.
Yeah.
I just heard like a little like all over, like
The-
fireworks.
It's exactly that. So,
Am I bleeding?
do you recommend this? Do you think, what the
Oh,
hell did I
yeah.
just do?
Yeah, I'm glad I brought him with me so he can do it.
Okay.
Yeah.
So your husband's gonna do this next. I don't know. I didn't tell you, but your husband left. He ran out the door.
No, you did not.
That'd be funny, right?
Yeah.
You're like,
I won't be surprised.
Hito, come back. Come back,
Come,
Hito.
have a seat. Gets hurt.
So
Poor
she's
guy.
she's like, yeah, I can't wait for my husband to do this, and he left. He's like, I'm not doing that crap. All right, so he's still here. So we have to work on him next, right?
Yes.
Do you think he should? Do you recommend floppy for everything?
Yes.
Floppy's good because it gives you something to hold on to. But you were like going. She was poor Floppy. Floppy needs look. Let me adjust Floppy's neck. Poor Floppy's neck. All right.
Whoa.
Poor Floppy. That's who I feel bad for. All right. So you did okay. Let's get you
Okay.
out of here. Let's bring your husband in.
Thank you.
So you might have to take your hat off because it's going to be in the way.
Oh.
So I'm going to have you lie face down. We're going to look at your back, okay? So you're going to put your nose right in here. And I'm going to have you reach your arms all the way out to here. You still okay over there, Tamika? It's crazy, right?
I can breathe so
Here, back up.
good.
Say it again. I couldn't hear you.
I could breathe so much better now. And looking inside my nose, I can see further back more. I don't know. I just feel like all of this is loose now. Like
Shoot
this.
over her shoulder.
This would be normally like really tight, and I'm always like getting a migraine here, and I will have to massage myself here. And now it's like, it just feels good. I could breathe.
Good. Turn towards us for a second.
And when my throat feels better.
Yeah.
When I breathe deep. Yeah.
Okay, good.
Thank you.
All right, we're going to start with this guy now. So let's get the camera on this side over here. You're going to stay in that corner for a minute. And I'm going to move Tamika here. So this is going to be your chair when you're ready. Okay, whenever you want to sit. You don't have to sit, but when you do. No, I want you right where I put it. So you're still, I need you with us too, okay? I do like this shirt. Your uncle had good taste, right? He liked
He did.
like cool stuff. But he liked, what do you call it, like graphic art, or what's that type of art called?
Music. He was into
Yeah, but no, but that-
music, graphic art.
Graphic art, yeah.
Yeah.
So cool.
Yeah.
I'm sorry you lost your uncle. How many years ago did he pass away?
Just a year ago.
Oh, I'm so sorry. That's really rough. So, Hito, what do you think of these spots? Here, turn your face this way towards us, okay? Do you feel these at all?
Yes, I do.
They're intense, right?
Yeah.
Is it more higher up, like here,
It's from there down.
and then here?
Mm-hmm.
Okay. And like this one, right?
Yeah.
I feel bad for you. You have a really tight back. Well, it's good that you came today. So, Tamika was the only one supposedly going to get filmed on the YouTube thing today. But when I saw him, I'm like, no, we need him also. Because you have to share it, right? You got to... We can't let him go home with a tight back. And he needs a balloon in his face, don't you think? Tamika's like, I want him to do the balloon. At least you'll be able to share the experience, right? Driving home, you'll be like, what the hell did we just do? What did you make me do?
My 15-year-old's what I wanted to come.
She'd come next time.
I want to go. I
Well,
need it,
you
the
should.
balls.
You should have bought her. All right, we're bringing her back next time. Okay, so we're gonna do a big spot here. Are you ready, sir?
Mm-hmm.
Big breath in and blow it out. Big breath in and blow it out. That's one. Big breath in and blow it out. Went just as I was jiggling it. Do you remember? Big breath in and blow it out. That's good. Bend the knees now. Like to here. That was a good one. All right. Lie on your side facing me. How was that so far? Good. Bring this knee up. Bring it up even higher, right there. Hold my hand to position. Drop your head. Got it. Whew. Big one, right?
Mm-hmm.
That feel nice?
Yes.
Never pops like that, right?
No, never had it done before.
Yeah. Turn this way on your side. So you're gonna go to the other side with the camera, and you're gonna pull this knee up like this. All right. All right. Lie on your back. Face up. I'm gonna reach under. Do one here and one here. Good. And now I'm going to do a little Y strap on you because Tamika recommends it.
Mm-hmm.
And whatever Tamika recommends, we're going to do today. Because Tamika has the recipe for you to feel good, I think, right?
Yeah.
You guys are a good couple. I like you guys. I really get that Tamika wants you to feel better. She's been in a lot of pain, but she also wants you to feel better. So that's nice, right?
Yeah.
She's like, maybe this will help him. So drop your head down and just let the weight of your head stay there, okay?
Mm-hmm.
Don't pick it up. So big breath in and blow it out. Big breath in and blow it out.
Oh, man.
Where'd you feel that? Everywhere?
Yes, I did. Ooh,
Did you feel it in your lower back also?
yes.
Which is
But
good.
mainly in the middle
Yeah,
part.
that's where
what.
you're
Yeah.
worse. That's where it starts to get bad, right?
Mm-hmm.
Wow.
Wow.
Have you ever had that done before?
No. Oh.
That part's done. I want to see you come stand
Wow.
up by your wife where you were in the beginning. So here, get to your side first. Roll to your side, and then put your legs down, and then stand. And come over here, and you're going to stand right here and touch your toes again, okay? But turn towards the camera. And do really slow, just a little bit, but stop when it hurts is what I want you to do. So just like you did before, and stop when it hurts. Not bad, right? How much better?
A lot better, yeah.
10%?
Because
20?
before, yeah, when I would do it, my back would just feel like real tight. Like I couldn't go that low, but now I feel like I can stretch a little.
Yeah,
more,
not bad, right?
Real good.
Yeah, good for you. So let's do the balloon thing, okay? I'm glad that that already feels better. Okay, you need a little work, but good stuff, right? A good start.
Yeah.
So you're gonna lie on your back. We're gonna do the whole thing for you. You're gonna have to hold floppy. I know you're, I hold floppy, so you could hold floppy. But it gives you something to squeeze. That's the main thing, and that helps. Here, scoot back towards me just a little bit. And which is your bad side again? Is it the right or the left?
It's the right.
All right, so we'll start on the left.
Okay.
Pick your head up, drop it over this. Beautiful. Oh, that fell a little bit. There you go. You can have a few tissues to put in your hand if you need them. Here's tissues. It's never a bad idea to have floppy nearby. And get the balloon ready in 2 seconds. Okay. So what did we say? We start on the left? I can't even remember right from left. Which is your bad side again?
The right side.
All right. Here, look at me for a second. So I know everybody watching thinks I can't remember left from right. I can't. I cannot remember left from right.
Can't wait.
So you can make fun of me in the comments if you want to. All right. The bad side is
The right.
the
yeah.
right. We'll start on the left. Ready? Here we go. Went right in. Now when you're ready, you can open your mouth really big,
Okay.
and then you close it and seal it off. Oh, you're done. That was perfect. You
Ooh.
felt it go all the way back, right?
Yeah.
What did you feel? Tell us.
Oh man. Like just pressure, like just opening up.
Did you hear cracks?
Yeah.
A lot or a little?
A little, not too much.
Yeah. What else did you notice?
Just I felt a little pressure on my throat.
You want to do another one? Do the other? Get it over with? Or you need a second?
Yeah, give me a second.
You want to sit up for a minute?
No, that's fine.
All right. Try to breathe. Any different?
Yeah, but it's more the right side that
That's the bad side.
That's the bad
So we're
side,
gonna
yeah.
go do that next.
Okay.
Should we do it?
Yeah.
All right.
Should I clean up?
Yeah. Why don't you sit up and blow your nose, and you keep the camera on me. Okay. So, so what the balloon does? One of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension, and the dura is like the sac or sheath on top of our brain and spinal cord, so it releases some of the pressure around that. And think of the casing on a hot dog being too tight, and we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage, and some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma, and it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. All right, let's lay back now. And We're gonna just do it, okay?
Mm-hmm.
There's never a good time, so let's just get it done. All right, let's see. Here, tilt your head back a little bit more. Here, wait. Just lay over that.
Mhm.
There you go. And put your head back. Here we go. Let me get it started. And then when you're ready, I'll just follow you.
Oh.
You did it again. And you can sit up if you need to. Here's some more tissues. That was crazy. That was a big one.
Ooh.
Here's more tissues. And here's a garbage can you can throw stuff into. What do you think? It's crazy, right?
Yeah. But it helps out a lot.
Yeah. What did you notice? Did that side crack?
Yeah, this side crack, yeah.
More or less?
Yeah, I felt this side more. I guess since it's like really tight,
Yeah.
since this part is more like bended, so.
Now, does it feel any different? I know it's too soon to tell maybe, but does it feel like, you know?
I feel like a little clearer.
Mm-hmm.
Like I can breathe a lot better now.
Did it hurt? Was it uncomfortable? Would you call it pain? You can be
It
honest.
was, yeah, it was a little painful. I mean, but I think anything going inside your nose,
Yeah.
yeah.
And are you glad you did it or not so sure?
No, I'm glad I did it. Yeah, I'm glad I tried it out. Yeah.
All right.
Hopefully it's a good thing.
Let's
you know?
get Tamika to come sit next to you for a second. So sit up here. Aren't you glad you had Floppy? Was good, right? You could squeeze the hell out of Floppy. Floppy doesn't care. Here's a box if you need it, okay?
Mhm.
So, you know, you had a 15-minute break just now. How do you feel now?
I feel good.
Yeah.
I can breathe better.
Do you have a headache
Yeah.
right now?
No. My ears feel like open, like like I was swimming, you know, like I was in the pool and yeah. I'm like, do I have water in my ears? What's going on? Yeah, it feels
interesting.
good. My throat also. I feel like I could swallow. Like I don't know how to explain
Yeah.
it.
So are you glad you did this?
Yeah.
Okay.
I'm glad I
And
did
Hito,
it.
what do you think? Now it's been 3 minutes. You haven't had a chance to even.
Well, it's the same
Yeah.
thing. Like, I mean, it feels a little better. Like,
Okay. All right. So let's, we might have you guys back if you want, and see if we can get rid of your headaches. Wouldn't that be cool?
Mhm. Yes.
All right. Please leave
definitely.
comments. Here, look at me for a second. Leave a comment if you want to see Tamika come back, especially to work on her migraines. And hopefully Hito will come with her too. She was the original patient. Hito was a random, spontaneous, let's get him in also and shoot another video with him in the video. I thought it would be kind of cool to have husband and wife in the same video. But leave a comment if you want to see her journey on migraines. Thanks. So open all the way. Open your mouth large. And then close off.